So, what might you need in your birth space? How can you change that so it works for you? So, if you're at home, so this could be a home birth or it could be early labour, the beginnings of established labour until you're ready to go in. That's one consideration. And then it's also thinking about what could help when you get to hospital, which is in a more kind of sterile, unfamiliar setting. So I guess for at home, it's having the things around you that mean that you can kind of be comfortable, that you can rest, potter, work with contractions, listen to music, and these could be things that you could also take with you to the hospital. So things like using your birthing ball, having some kind of mat or something on the floor if you're doing kind of floor work, so kneeling, and could be pillows, whatever works for you, and kind of a cushion that can help. So I've known women want to take all of that in with them, and that's absolutely fine. You take with you what's going to be familiar, what's going to help you to be able to stay kind of active and feeling comfortable and safe, really. So listening to music, which could be through speakers or through headphones, whichever works. I would definitely say pack headphones as well, though, because sometimes you just want music in your ears and it helps you kind of really zone out, especially if there's a bit of noise at the hospital. Is the space quiet enough? And it could be that there's a bit too much chat in the room, and that can happen sometimes. Kind of everybody's quite chilled, quite happy. There's a bit of conversation. Sometimes I'll get into conversation with dads because that distracts and calms them. But if that's not right for the woman who's in labour, she will say so. Some people are really bothered by noise and chatter around them, and for others, it doesn't bother them at all. So we're getting back to that need to be at the centre of your care. Say what matters for you. If you need more quiet, that's what you need, and everybody needs to get on board with that. Do the lights need to be dimmed? Will that help you to settle? Will that help you to focus and feel kind of safer and calmer? Think about what it is that you need within that space to make sure that you're as comfortable and as supported as possible. Is it private enough? Are there too many people in the room? Do you want to minimize who comes in to your birth space? That's fine. You can absolutely talk to your midwife about that. They can gatekeep and protect your space much more. Feeling safe in labour is really, really important. So thinking about what it is that you might need to feel safe. And some of that will come from dimming the lights, from having as few people in there as possible, and just knowing that you can get the information and reassurance. It could be that you need your midwife with you more because you're having to share her with somebody else in labour. If you're calmer and kind of just much more reassured when she's around, ask, see if it's possible. It's not always, but see if it's possible that you can have more of her to help you. For some people, having a familiar scent helps you get relaxed. So it could be something that you use at home. It could be something that you have purposefully used as part of your birth preparation. So having that available can really help, as does having food and drink available. So at home, it's easier to have these things out. They're easily accessible. I tend to find things stay in bags when we go into hospital. Get things out. If they're out, you can graze and you can snack as much as you need to. It's easier to just grab something and offer it as a birth partner, or to kind of point and say that you want it or take it if you're the person in labour. Um, do you have the freedom to move as you need to? What do you need in that room? Is there a ball? Is there a mat? Is there some maternity units have like big bean bags? Are there enough pillows? You know, ask for those things that you need. Sometimes it's about having something that's going to make you more comfortable on the bed if that's where you want or need to be. It could be about altering the lights. So with dimmed lights, some people also want fairy lights to kind of alter the mood. Sometimes it's about having really kind of gentle sensory lights reflected on the walls or the ceiling. And some maternity units offer that. Sometimes it could be something that you bring with you that, you know, they're not very expensive. There's some like a small thing you can pop in your bag and you just plug it in. That could be an option. So double check these options, these facilities for your maternity unit, because they could make all the difference to making this space feel like it's yours. That can be really important for some women when they're in labour. Um, with the birth space as well, you know, having things like a blanket or a scarf, or that can help. It's a familiar item. It's something that might make you feel cozy and safe as well. So packing anything like that, thinking about what it is that could make a difference to you if you are feeling a bit vulnerable. Um, and I often get asked, you know, am I taking too much in? Really, you just need to take in as much as you need. There's no harm in wheeling in a giant suitcase and your ball and a V pillow as well. You know, better to have it than not. And if it means that the space that you're in is more comfortable, then you will get the benefit of that. So get that list written for what you need for home and for hospital. And for at home, you can be using some of that throughout your third trimester as well to be comfortable, to practice positions, to be practicing your breathing and just connecting with how your body feels, and maybe easing some of those end of pregnancy discomforts. You know, heartburn, sickness can reappear, headaches, backache and pelvis aches, tiredness, just managing all of those, because that's a connection with how you might manage things in labour as well. Nothing's in isolation. So connecting everything and get a good list going, because it will help, I promise.